Hi, and welcome to this segment of the NCTV series on homelessness, Where Do We Go From Here? I'm Al Dover. I'm a retired Superior Court judge from Nevada County, and more importantly today, your host for this segment of Where Do We Go From Here? My guest this afternoon is Brendan Phillips, the Housing Resource Manager for Nevada County. Brendan, welcome.
Thank you.
Brendan, I wanted to read something to you. I know reading is boring on TV, so it's going to be quick, but the County Grand Jury Report of June 24th says in part, the designated county person, voila, should provide the leadership and coordination to identify and develop funding sources, provide skilled grant writing, work to overcome the culture of homelessness, serve youth under 18, help in the development of day shelters, provide post-jail placement, coordinate placement of homeless persons after medical treatment, provide veteran service referrals, find housing for persons on medications, find appropriate housing for individuals with companion or service animals, find housing for ex-offenders and sex offenders, provide emergency placement services, seek funding for alcohol and drug addiction rehab services for individuals with no insurance to cover these expenses, and finally, you're also supposed to work with all the stakeholders, finding ways to allow for the creation of more affordable housing, and given the task of working with all stakeholders to provide seamless delivery of services to homeless people. So my question is, are you done yet? You know, you've been on the job for 5 months. Are you done?
We're working on almost everything listed, but no, not done by any stretch of the imagination.
So tell me, Brandon, I mean, before we get to where do you even start with a list like this and a job description like that, tell me and tell the viewers a little bit about who you are that, I mean, someone, a county has tasked you with this, what sounds to me, and I'm sure sounds to most people, like an enormous job. So tell us a little bit about who you are to do it.
Well, I started out working on homelessness in Olympia, Washington, when I was getting my 4-year degree in political economy. I was working at a day center called Bread and Roses, and I started really taking on individuals who were experiencing homelessness at that point, helping them acquire services, figure out and navigate all of the different possibilities that they may have had. So that was the beginning. That would have been, I'd say, 2005, 2006. I started working on issues of poverty and homelessness for years after that in various capacities, all the while singing songs, telling stories, and imagining myself a folk singer, sort of in the vein that my father, Utah Phillips, before me was. So I played a lot of his music. And those songs are connected to poverty and homelessness in many, many ways. And, you know, the songs of Woody Guthrie and the songs of Pete Seeger, it's very, very rich and deep well to draw from in terms of music in this area and the folk traditions around these issues. So they also influenced who I am. I started working after I worked for the governor of Washington State, Christine Gregoire at the time. I was a constituent liaison. I was working with constituents. Most of the time I would be the guy they called when someone who was experiencing homelessness or a mental health emergency would come to the governor's office and demand of the governor to do something. You know, I need something, or this is what's happening for me. So they would call me into the front lobby area, and I would sit on the couch there and talk with the people and try to help them find the services. And I had a little bit of power and clout. I could call the agencies that they were talking about and say, what are you doing for this person? Can we get some help? So I was doing that, and I was learning a lot about sort of the systems that govern homelessness and the policies that govern health and homelessness. Right after that, I started working at Sisters of the Road Cafe in Portland, Oregon. Sisters of the Road is a place where you can go and get a bee during the day when you're homeless, and you can get a meal and a cup of coffee. The meal is $1.25. It's been that way for 30 years. A cup of coffee is 25 cents. You can use your EBT card, your food benefits at the cash register to get a warm meal. And it was all founded by an old mentor, one of my father's friends, Jenny Nelson. And she went into the community, you know, in the 70s and said, what do you need? to predominantly homeless women. And the women said, we need a place to be with our kids during the day, that it's safe, or we don't get preyed on and we're not being moved around. So that's what the impetus for opening a cafe was, and that's what Sisters of the Road was. But Sisters had a new mission and a new vision, which was to do community organizing. And so they hired me as a community organizer to work with homeless individuals on really just bringing their words, their wisdom to decision makers in the city. So that's really where I got my start, really working on these issues in depth, but mostly working with individuals to talk about what is systemically wrong with the system that leads to homelessness, and to unpack the nature of homelessness beyond just individual fault or circumstance, but really what is the real problem. And in that time, the 2.5 years I spent there, I met so many, I would have to say, way more intelligent people on what the issues are who were homeless. And they had a very good perspective, and I was able to take that perspective and translate it into system work, and work that we would do with policy people. So I left that job, and I decided I was going to become a folk singer again. And I wish I had remembered what my dad told me. He had told me when I was young, he said, if you want to make $1 million in folk music, you should start with 2 million. And I didn't learn that lesson. I didn't. And then he also said, there are literally tens of dollars to be made in folk music. I should have taken those things to heart. I didn't. I started, sort of drifting aimlessly, if you will, and I landed on my mom's couch in December for Christmas of 2012. My sister had come back from Boston. My sister is a social worker in Boston, and she works with homeless people who are largely African American community, AIDS and HIV, heavy issues. So there's a day center there that she runs, and she was an organizer for. So she started peppering me with questions, and I would answer them, and get away, I just want to sit on the couch and watch my football games. And she finally said, when you answer these questions, you talk about these things, and I know your experience, it sounds like you want to be a social worker. So I got off my keister, and I got cracking, and I filled out a number of applications for schools for my master's degree, ended up at Portland State University. Graduated in 2015. That entire time I was in Portland, I did a ton of work with the homeless community there. There are many, many alternative camps and micro house villages and pod communities and all these different really innovative ways that people are starting to put themselves into housing, in addition to building actual permanent housing. So working with those communities, I really got to learn a lot about what was going on the street and what people needed, and then what the policies were doing to use the wisdom and words of the people who were experiencing the issue to make and craft policies that could help people. So then I got my master's degree, and last week of master's degree was fill out a resume, find a job that you want, and then the professor will review your resume to make sure that it looks good and that it meets the requirements the job you're looking for is. And I found a job for Turning Point Community Programs here in Nevada City. I knew I was going to be moving back here, so I applied for it. And 2 weeks later, I was on a plane to get to interview, and then they hired me, and I worked at that position for 2 years. And then this job came up, and my supervisor, one of my supervisors, Suzanne McMaster at Behavioral Health at the time, said, you got to apply for this job. I mean, you talk about this stuff, you know what you're doing. You should you should go and apply. And so I did. And that's the first thing when I was researching the job. The first thing I found was the grand jury report you wrote, or that you read from. Mm-hmm. And I looked at what they were saying, and I started thinking housing resource manager and looking around in different communities, Napa and others, and just doing some research so I could really sound like I knew what I was going to be doing, and met for the interview and was able to get the job. And like you said, 5 months ago, that's what happened, end of August, or beginning of August, yeah.
Okay, so
that's it. Okay, we done yet?
Well, no, we're fortunate. There wasn't a box to just say folk singer.
Oh, yeah.
You would have been applying for that job.
Yeah, yeah.
So here you are.
Mm-hmm.
We're about 5 months down the road. You know, from that list, the first thing that occurred to me when I read that list is, where do you start?
Yeah.
And so, can you kind of give me an idea of where we've been for like these 5 months? Where did you start? And then also maybe kind of describe the job as you now see it, having been in it. Yeah, I know, just for 5 months.
Well, so you start, I mean, the community organizer in me says you start on the ground with the people who are working to solve or address the issue. So we have a continuum of care, Nevada County continuum of care, and so that's where I started. I mean, I think that my first week, the first thing I went to was the process improvement group that Heidi Hall, Supervisor Hall, had called together, and that was going to look at some of the gaps that exist in services. And then that document that they created together over a series of months was transferred into my care to move into the NCCC, the continuum of care, so that we could discuss how are we going to close these gaps. So you start there. You start with the people who are actually doing the work, and you start by listening and understanding what the gaps are, and then applying. I applied my own. I had worked for 2.5 years with behavioral health as a person running around the county, trying to find these kinds of services for people: housing, apartments, working with landlords, substance abuse treatment, whatever it was. So I was well aware of those gaps. But so it was really encouraging to see that as I came into the job already, a community process had been borne out where we had a consensus opinion on what those gaps were. And I could look down that list of 39 gaps and say, yep, we got to close all these gaps for sure. So that's where you start. You start with the people. So my view of what the job is, it's evolving all the time. It really is, because I think that there's a very big need for someone who can hear all of the different constituents and the voices of the people experiencing it and sort of meld together a plan or a process for accomplishing a plan. And of course, underneath that is a need to fund a plan. So there's definitely layers of needing to understand what grants are out there and how grants can be applied for, and how we can and get the funding we need to do the work we want to do. And so those are two big parts of the job. I just think that it's a coordinator position. It really is. It is pulling together people from the different strains of community work and county work, and building a process together that can change things for people who are homeless. So it's not I would leading from behind would be the main, why the job exists. There's plenty of leaders in the community, and there are leaders in organizations that are doing great work. It's about making sure those threads are all woven together in a way that creates that net that we need to hold people when they fall down real hard. And that's what happens in homelessness is, you've got people who've been out there long enough. It's going to be a difficult task to move them ahead, and it's going to take multiple people to do it. And so we got to thread them all together.
And so when you talk about these gaps that you were aware of and that you find when you look around and see what services are out there, give me an idea of maybe the biggest, 3 or 4 gaps that you've experienced or that you see or know are out there that have to be that needs these threads, to connect.
I think so. One of the gaps for sure is when we have people who are experiencing homelessness and their condition of homelessness leads them to be arrested and put into a jail. When they are released, they go right back to the street. So a gap that I think we've really worked as a county hold closely to close is when people get significant time clean, if that was their issue, or have been accepting of medications, and that may have happened in the jail. When people have the capacity all of a sudden to be engaged and to move into a better system or into a better frame of thinking about what they're doing, then we need to hold them then. And so that day that they get released at 8 in the morning, it can't be that they go to the street before anything happens. So when we have in the past had people hit the street, I was working very hard to secure a bed. We'd have beds out of county for residential treatment. Those beds require the person to be out of jail before they actually can be accepted for the bed. And so I'm holding them in a motel or a hotel, or I'm trying to get them into a service. And so the gap that we needed to close there is, how can we get someone who's ready for treatment for a long-standing substance abuse issue right into that treatment bed with no lapse into homelessness again? That's a big gap.
And if someone watched the segment right before this with Ariel Lovett from CORE, she would explain in some measure how CORE certainly does that.
Yeah.
And the judges that had mental health court, drug court, were also trying to talk about just that, breaking that cycle of arrest, incarcerate, release, arrest, incarcerate, release. So when we come back, we're going to take a little break here, but when we come back, I'd like to follow up with you for a couple of more of those gaps. And in terms of planning, a little bit more about that as well, okay?
Sure.
Okay. We'll take a little break here.
I had been in Portland, Oregon working at a place called Sisters of the Road, which is a cafe for homeless individuals. It was started by Jenny Nelson, 38, almost coming on 40 years ago. And she started out by just walking in the streets of Old Town, Chinatown, which is right in the core of Portland, Oregon. And she discovered that through interviewing and committing to a path of community organizing, being that of meeting people where they're at, being very concerned about the conditions on a day-to-day basis, and learning from people who are experiencing the situation rather than assuming that something is needing to be done. So she went out and said, we're going to start something. We don't know, and we want to find out more about what you all would want. And so mainly women with children said, we need a safe place to be. We're out here all night, all day. We have to keep moving. We have to look behind our backs. We have a very difficult situation with being single women on the street. They wanted a cafe where they could be, because they obviously would go to other cafes and they'd get rousted out because they were not paying patrons and they couldn't afford what was being served. Jenny likes to say that if they had said we want a laundromat, it would have been a laundromat. But it was a cafe, and the concept was dining with dignity. And dining with dignity is the idea that all these folks that were homeless were saying, we don't need a soup kitchen. We don't need to line up and be told to leave immediately, and we want to work for the food that we're getting, and we want to be a part of the organization. And so they started Sisters of the Road together. And those volunteers who were homeless, who led the organization, set the price of $1.25 almost 40 years ago, I think. It hasn't changed, for a meal, a good warm meal. And volunteers serve you at your table. You order. It's just like a cafe. You order the food at a cash register. You pick from a menu of options. Volunteers bring you your food. You sit, you eat, and you get to be there without having to worry about being told to leave. And there's a personalist center next to it and joining it. And there is where I worked as a community organizer. And so I really got to sit and be with people who were experiencing homelessness for all sorts of reasons. And that's where I really started to get a sense of what situations have created homelessness. And I really started to understand more about the growing number of West Coast, in particular, organizations that are partnering to raise awareness about the root causes of homelessness.
This series is made possible by the generous donation of Stifel Financial and viewers like you. Thank you.
Hi, we're back with Brendan Phillips, the Housing Resource Manager for Nevada County. And Brendan, we were talking about some gaps when we finished a minute ago. I wanted to mention to you that I know Judge Heidelberger and Judge Slovin, who handle our alternative courts, talked about also trying to get up and running more a community court to deal with quality of life offenses, so that people simply aren't arrested for loitering, arrested for illegal camping, arrested for being under the influence, incarcerated, released, arrested, incarcerated, released, that resources are brought to try to identify more underlying issues and help people break that cycle. Would that also be, in your view, that kind of gap filler, a good community court approach like that?
Yeah, I mean, I think, so the gap that I think is the biggest gap is hope. It's hope that there's something different that can happen from one day to the next day for someone who is out there. There have been big studies done on all of the kinds of interventions, so community courts, cognitive behavioral therapies, all sorts of stuff that they do with people. And the thing that comes back is that a huge percentage of someone's ability to make a change is related on how you've instilled hope in the person, that there's basically that change can happen and that something can look different in a meaningful way in a specific amount of time. So when you have someone who's been out there for a really long time, going through the cycles that you're talking about, constantly getting shot down, meeting those services, meeting a me or a you or a someone who's going to walk them through the process of signing a lease, training them on how to help, how to be a good tenant, doing, getting through days and days, weeks and months of sobriety. What all of those things are, it's that connection that you've made with that person that's going to hold that person and give them the ability to see that there's something that can happen that can change. Because if you can imagine, here in this community, we talk about housing, of course, and so the community court system, right? Like, if the services are going to come in and offer services, then those services have to be offered in a way that would say to the person, something's different here. I can take advantage of this and I can make change. That's hope. So I don't know, I'm not specifically keyed up enough on what community court would entail, but I think that we really have to have a heart-to-heart moment, or come to the core of it moment, where we can say categorically that the services we're going to offer in these situations are going to make a real difference for someone. Not go to another landlord, ask another landlord to rent you a place, only to find that your criminal history and other things preclude you from being in that place, and suddenly you're back to square one again. So we've got to end that cycle, the cycle of hopelessness, not just the cycle of in and out of jail and the stress that systems experience from people who are high service users. So I would say that those gaps and all these gaps that we're talking about go hand in hand with a very human need for us to work with people in a way that can give them hope. It seems simplistic. It seems sort of almost passe or something to say that that's what we need. But we could spend $1 million on the best facility you've ever seen, and if we can't give people hope that there's going to be change in their lives, the facility is just a holding a place for people to be, but not actually get any services. So services have to work with people. We hear these terms like service resistant, for example. People, in my view, no one's service resistant. Services often are resistant to work with people that are really hard to work with. And of course we have grants that we need to provide outcomes and data on to our grantors. And so when you start talking about trying to get to those people are going to be the hardest to serve, and in a 3-year grant time frame, you might have to go back to your grantor and say, we didn't do anything. We didn't get these folks housing, we didn't get them off the street, we didn't get them residential treatment. That's hard to do. So you don't go for those people. You go for the folks that are a little bit down, like maybe more able to accept the services. So I think we have a problem as service providers in understanding that hope deficit and realigning our services to understand how to work with people that can really move them into a place of stability and a place of being able to, make those changes. So I'm encouraged by community courts. I mean, we can do a lot with community courts. I hope that the community courts exist, this would just be my thing, not in the courtroom. Yeah. For example, like we would have a place where community courts would happen and a judge that would preside, but it would look more like something that people who are experiencing these things and going through these constant cycles, doesn't just look like another courtroom. It doesn't just look like another judge telling them, you got to get this together, another officer escorting them in with an orange jumpsuit on. All of that stuff, is part of what we need to think about when we think about true community courts, in my opinion.
Yeah. And there aren't too many places that say, well, let's go train people in how to instill hope. Mm-hmm. And people have these specific jobs that generally don't have any element of, oh, and don't forget, instill some hope. But what you really, it sounds to me like what you're really saying is everybody that comes to this should understand that that is a truly important element that really has to be offered, so that somebody can actually feel it at the end of the day.
Yeah.
So they can go, okay, I know I have to go through these hoops, but it's worth it. It's just not another dead end. It's just not another hopeless bureaucratic hoop.
Yes. Yeah. And I mean, you know, one of the things I like, my mantras is, you know, act like you got 15 minutes, it'll take all day. Act like you got all day, it'll take 15 minutes. So it really is a mindset. So one of the things that the county, that I've been working on in the county is for our community providers and for the county providers that are working with people who are experiencing homelessness and hopelessness, is to receive a training that I worked heavily on in Portland and in Multnomah County. And Multnomah County's workers across the spectrum of workers, from people in eligibility to people all the way over to, you know, housing case managers and stuff, receive this training. It's called Assertive Engagement. And
it's called
Assertive Engagement.
Assertive Engagement.
It's not a great name. No. Yeah, not a great name.
Okay.
But the idea behind it is that there are three things that you need to do when you're working with folks. One is this understanding of the research on what works. So, you know, I think we get all into the numbers and we think this is what works or this is what works. Well, the research says, and they've looked at all of it, the research says you have to build a relationship and instill hope. That's the biggest bulk of the pie. 15% of that pie wedge is the methodology you use. Wow. Cognitive behavioral therapy, some other thing, you know. So that's that little slice. If you're just doing that, there's, you know, 85% chance that all the other 85% isn't being covered. So what Assertive Engagement said is that we have to go into these engagements with a heart set. A heart that is set on bearing witness, sidling up alongside someone and seeing who they are for what they are. Then there's a mindset. So what's your mindset? Is your mindset just going to be that this person needs to do this? Or is it going to be, the mindset going to be that I'm going to help this person understand what's going to happen, and then listen to what they have to tell me, and then we'll talk about that, and then we'll go back. So the mindset has to be more about, like, not, you know, going and telling, here's the menu of things you need to do. The mindset needs to be really in keeping with what the person's ready to do and where they're at. And then the final part of it is the skill set. What's your skill? Well, the skill set that they work on in Assertive Engagement is called motivational interviewing. So it's a, you know, substance use treatment heavily uses it, but it really is learning about using assertive listening skills to really learn about where someone's at and experience what they're experiencing, and to be able to build a relationship using those kinds of things. But most of the time, it's ambivalence. People are ambivalent. When you talk to me, what are you going to do today? You know, I don't know. I don't know. I kind of want to watch a game, but then, you know, I mean, so everyone's ambivalent. So when you come to someone and say, you need to get treatment. No, I don't. You know, well, do you think you need treatment? No, I don't need treatment. I'm not going to need treatment. You know, I don't use that many drugs. You know, sometimes I use drugs. I don't know. Sometimes it kind of hurts my family when I do that. You know, they talk themselves into it. I've seen it happen so many times. With motivational interviewing, it's just like you watch someone talk themselves into exactly what you want them to do. But it just takes a little longer.
Yeah.
But when someone buys into it for themselves, they're really going to do something. When they're being told to do something, they're not going to do something. I mean, this is just basic psychology. I have a 2-year-old. I can't tell my 2-year-old to do anything. I mean, you know, like, pick up those things on the ground, you know? It's like, so, you know, I'm trying to practice a little bit of this on the 2-year-old, you know? Do you think you may want to pick up some of those toys? No, Papa, I don't want to pick up those toys. Well, what's going to happen when we leave the toys there? I don't know. I'm going to trip on them and fall.
It works like this. Which toy do you want to pick up?
Exactly. You can pick up that one, and I'll pick up this one, and then maybe together we put them in there, and we can, you know. Exactly. So yeah, I mean, it's a little reductive, of course, to talk about it into the frame of a 2-year-old, because an adult person has got lots of different things going on. But so assertive engagement training for our community partners, I think, is really important. I mean, I think if we all can have a set philosophy or a set, you know, understanding about what works, I think from the county person who's doing a CalFresh benefit package to a worker for Sierra Roots who's in the park helping someone get some food that day. If all of those people are united around a set of skill, a heart set, a mindset, and a skill set that can really instill hope, I think we'll be a lot better off. I mean, it's not something that you have to throw money at. Right. It's something that really does give the community a sense of involvement in the issue, and then we can work from there.
So, so if we have that, let's then talk about money. Let's talk about budget for a minute.
Yeah.
I want to do it in this context. I read an article. It said Bergen County, New Jersey, which I actually don't know much about, was reported to be the first community in the United States to end chronic homelessness. A one-stop shop facility that was created with an $11 million grant on a housing first model. Now, I'm wondering, is that something that you think has some traction here, something we can replicate? Like I say, I don't really know Bergen County, but I understand what they're saying when they say one-stop shop facility. They're talking about wraparound services and a place where there's really a place to be, where they first build the homes or the apartments or whatever, but the shelter. Is that just about money then? Is that the success story?
It's about money. It is about money in some levels. But yeah, so we presented a plan to the board that includes what we're calling a navigation center. It is exactly what they're talking about here. It's a one-stop shop, if you want to call it that, but really not. It's more about a place where people can be during the day. So we have a shelter that opens its doors at 7 a.m. and people need to exit the shelter for the day and they can come back at 4. So what happens during that time, So what happens, I can tell you as someone with some direct service experience, is I run all over, as well as all my colleagues run all over town trying to find people, to get them to appointments, to get them into things, to do the things that we need to do to connect them to the services they need to be connected with, even services that they want. And they've got lives, and they're busy, and they're doing stuff too. So it can be hard to find folks to keep a plan going. So we are working on, and potentially even as early as July, opening a day center. We're calling it a navigation center, I think, because day center gets too close to daycare center. We're really talking about a navigation center, a place where people can go and have some Maslow level needs met. So we're talking about basic human needs. There's times when I'm out in the public and I see a woman and she's in a public bathroom basically showering. We can't have that. I mean, if you're going to expect that person to go get a job and do the things they need to do, then they need to be able to have some of those basic human needs met to be ready to do those things. So we need to find some way of providing some of those basic services. So we're exploring that. We're also, how do we create a place where multiple entities, service providers, can interact and share individual clients and talk about those folks together and parcel out what needs to get done and who's best to do it and direct them in the best possible service stream. Right now, we are, someone might have to go knock on 15 doors to find the right service. So we gotta streamline that and make it so that there's a one door opens all doors kind of approach, So that's where we're at. We're the Housing and Urban Development, where we get a lot of our federal funds, requires us to do a coordinated entry system, which we are implementing and will be live January 23rd. Okay. So connecting point 211 will be the entry. So if you are homeless and you call 211 and you say, I'm homeless, they'll take you on a series of questions and you will get assigned, you'll be on a list of people. And pretty much all state and federal funding is heading this way. We need to use a coordinated entry system to identify who's homeless, and we need to work on a list that is prioritizing them from the most vulnerable to the least vulnerable, if you can call it that. But nonetheless, you then have to apply funding to the most vulnerable first and work your way down the list. So when we have the coordinated entry system, we'll have to build into it some humanity. Because that's just, if I'm someone who's homeless and I call 211 and I say I'm homeless and they take me on these questions and they give me a referral to Hospitality House and they give me a referral to our behavioral health department, most of these folks have been there, done that. So we need to have some humanity injected in. We need to have multidisciplinary outreach and case management. And so our navigation center will be a place where some of that can take place.
Well, that sounds really excellent. And I'm wondering, kind of apropos of what we're talking about here, there was an article in today's paper about, I think it's Seaman's Lodge and maybe the Nevada City Vets building being available, but it's only available if it's 31 degrees, not 32 degrees. If it's rained 3 days in a row, not 2.5 days in a row.
Sure.
It sounds like, I don't know who's measuring. I don't know who's going, it's only 32 degrees, you can't come in.
Yeah.
I don't understand that in terms of that bureaucratic blockage
Sure.
to this completely human need.
Sure.
And in terms of the whole hope aspect, that to me would seem crushing. So does that system you're talking about now have any way to interact with this problem?
I think the emergency, like cold weather shelter situation.
I guess that's what I was talking about, the warming shelter.
It's tough. I mean, we have a big county. We have a county that has a town in it called Truckee.
Yeah.
Truckee's requirement is like 15 degrees.
Right.
It needs to be below 15 degrees. So in order for them to open. So they would have many more days potentially where they would be open for cold weather, right? So if we support, so we have to look at how that financially that would work. And I mean, if we're talking about opening a navigation center, building affordable housing, creating permanent supportive housing units, and using the housing first model, which we'll talk about in a little bit, those are all high dollar items too. So we have to look at how we weigh this all out. We are really fortunate. We have a group called Sierra Roots, Janice O'Brien and Keith Cantrell and others that do wonderful work. And they have worked out an agreement with the city to open the shelters and have signed and agreed to what I am under. My understanding is they actually raised those levels. So it used to be 28 degrees or below. Now it's 30,
right.
32 or whatever. So I think that that's just in keeping with, like, they can't be open all the time. That it, if we set the level at 40 degrees or below, it would be open starting at the end of November and ending sometime in March, and they'd be every day. So they had to kind of weigh what they could do as volunteers. But I think we have to look at how can we have an adequate emergency shelter situation in this county. And I came into the position at the end of August with all those things that are going on and getting acclimated. I feel really confident that we can, over this next year, provide guidance, technical assistance, and strengthen that model so that it can really, really be open when it's needed and always have the access to a facility to be open in. Those are really important things. I don't know that where we're going to get the funding to do it, but I'm hoping that the plan that I've provided to the board that has a housing first element, the navigation center, and the multidisciplinary services will bring us into that level of work that's getting done around the country, the evidence-based practices, that when we go to apply for money, we say, we already do this. We're not asking for you for money to do something that we should be able to do. We're actually doing it, and now we want money to make it sustaining. And so I'm going to be out there looking for exactly these kinds of monies to talk about what is emergency shelter, how can we strengthen those time frames, how can we make sure that people have a place to be when they're cold and they need to be inside. But it's a process that's going to take some time, and unfortunately, the time that I came into the position to the time that we're talking about probably means this winter is going to be a little bit more herky-jerky as it's been in the past, and we're going to have to work on strengthening that process. I'm committed. I mean, I don't want anyone. Portland, Oregon, where I lived and worked, had 82 people die last year on the streets and related to cold weather, and they have many cold weather shelters, and they have many homeless shelters, and they have lots of funding that opens up facilities that are open 24/7 during these cold snaps, and yet still people die outside. So again, I think there is more at play than just having a physical place. We need to be focused on a lot of other issues all at the same time and raising the tent poles all at the same time. So I'm hopeful that by next winter we'll have a much stronger winter approach and be able to make sure that we don't have one more person die on the street. And Usually we're pretty good at it. And Sierra Roots, I got to give them a lot of credit. They've taken a small group of committed volunteers and have it's their work that over the last 4, 5, 6, 7, 8 years have ensured that we haven't had a really high degree of people who are suffering from getting near death or dying on our streets. So, I want to work closely with them, and I'll go by what they tell me they need, and then I'll occasionally jump in and say, but what if we added this, or what if we added that, and see where we can go with it. But we'll be able to build that out.
That's fabulous. This may be kind of a natural place for us to take a short break, so we're going to do that at this time and return in a moment.
So where are you living now?
I live in my car.
Okay.
And so I have, the nice thing about like the military, I mean, they taught me how to be organized and how to like camp out if I need to. Plus I love camping out, but I kind of, organize my car as a little home and pretty much everything I need. And then also the co-op has been really helpful because I'm very much into eating healthy food. And I need like a ketogenic, what they call a ketogenic diet.
So when you say the co-op, you mean Briar Patch?
Mm-hmm.
Okay.
So I spend my evenings there. I use the internet, but I also, I order dinner. And it's a little more expensive than, of course, at home, but it's still, when you compare that to rent, maybe my food bill with supplements, $800 a month.
This series is made possible by the generous donation of Stifel Financial and viewers like you. Thank you.
Well, we're back, Brendan, and I wanted to just kind of follow up on our last bit of conversation here, mentioning that in the same article about Bergen County was also mentioned about Oakland, a little closer to us. It said Oakland had built official homeless campgrounds with trash pickup and portable bathrooms as a kind of a temporary measure. I mean, I'm sure there's all kinds of issues around campgrounds, temporary, but again, is that something in this transition between emergency to temporary kind of shelter like on a campground with actual city or county services to permanent housing? Do you see that have any place in the system here?
I guess I'm not sure how to totally answer that question. One of the things I would say is that, yes, homelessness looks different in every community. And one of the things I'd say to that effect is we have a tinder box around us, and we have people that are camped out, and they have campfires.
Right.
And so the idea that you would open up some space where people could be, that that sort of activity could be minimized, I guess, being way out in the bush and having a fire, it seems appealing. I, as a community organizer background, I've seen camping work when it comes from the community. That's both just actual homeless campers who band together and say, look, we don't have a place to go. We tried the shelter. We can't get in. We've tried this stuff, so we're going to plop down here, sort of like and we're going to do this. When that kind of happens, and then they get community support from the broader community, that's sort of more how that kind of works in my mind. I'm not so sure that, and I don't know the iteration of how Oakland did it.
And I don't either. This article just said it's an official homeless campground, which meant the city or the county is providing these services of trash pickup, et cetera, treating it like it's an enclave of some kind.
And so I'm imagining, though, that this place already had a bunch of people camping on it. And now the city's, rather than coming there and picking them all up and taking them to jail or rousting them out of bed and moving them along, is now saying, okay, we're going to go ahead and put some minimal level services up here.
Right.
We've got a Hep A outbreak. We've got to provide some basic level of sanitation and services and do it.
Right.
So again, I think that so right now, I don't go and drive around Nevada County and see an organized group of campers we still have these people out in the bush. So I'm not convinced personally that without the right organizing amongst the homeless community itself and the community that we have, that you wouldn't, to do something like that. It's not if you build it, they will come. This isn't
Right.
Field of Dreams, you know? So I don't see it as part of our continuum right now, and that's not to say that it couldn't be. It's just, to me, I'm focused on housing. Like we all, you know, I mean, who would have, you know, a great mentor of mine down in San Francisco, Paul Bowden, said, who would have thunk it? Homelessness is solved by housing.
Yeah.
You know? So, I mean, it was sort of you know, and his point to that was just like, you know, we need to build more housing, affordable. I think he would, you know, I agree. We need to have housing that is affordable for multiple layers of people. We have people who need, that are in low income units that would like to move up into a more workforce style housing. So we have a lot of housing needs. And in the state of California, it is, a stat I read was we would need to build 180,000 units of housing a year for 10 years to meet today's demand. So we have a simple supply and demand problem. I mean, it's not a simple problem, but it's simple in terms of economic theory. When you have way more people demanding to have a house, being in a house, and there's not enough houses to put them, then the rents go up, jeopardizing people who are marginally housed and could be out. You know, I mean, when you're spending over 50% of your paycheck on rent, you know, it's very hard to absorb an engine breaking down on your car or a kid getting sick and needing, you know, having medical bills. So we have those people too. And then we have all the folks who are chronically homeless and cycling in and out of homelessness. So we need housing, and we need housing that has services built into it. And so that's where I really want to focus. I mean, I think we could run around really quickly if we started doing a lot of other things that didn't really have your eyes on the prize. And, you know, we need to have our eyes on that prize.
Because you're not saying there are the demand is so much greater than the supply that it isn't worth trying to meet the demand. Because homelessness needs homes.
Yeah. And nearly homeless people need affordable homes. So we need to build the housing to bring their rent, you know, so that the demand is met, and so that we don't have situations where, you know, a 10 by 10 box costs $2,800. You know, I mean, people are, you know, want to stay in their communities. You know, there are people who are homeless now in Oakland that have lived in Oakland for 30 years, and they can't afford to live in any place in Oakland. You can't say to them, you got to move out of Oakland then. I mean, that's not, you know, we can't move people out of our community. There are plenty of people in Nevada County who would leave Nevada County if that's what the message was. We have to build houses for people that have lived here and are part of our community. You know, when we do our counts every year, we're doing one on January 25th, you know, we ask the question, how long have you been here? And the majority of people have been here over 5 years. They are us and we are them. They are part of our community, and they can't afford housing. They end up on the street, and the longer they're there, the harder it is to get them back into housing. So we got to be building housing. And
I think in a conversation a little bit with Ariel Lovett from CORE, said it's not just housing, it's not just these services, you have to have one and the other. You have to have someone stable enough to be able to look after a home, to appreciate what that means. And so all these things kind of go together, which is why your job description is so broad.
Yeah.
As I understand it.
Well, supportive housing is an evidence-based practice. And for people who are homeless, putting them into housing, you have to have that level of services. And the services need to be, they have to be voluntary, but they have to be assertive. So, I mean, people have to be going and checking in on people, building those relationships. And over time, you build those relationships, you can get your foot in the door. It can take a while sometimes. We are embarking on a plan to introduce truly housing first. It's a very big, complex issue, because right now we do have housing first. For chronically homeless, mentally ill, severe and persistent mental illness, we have a permanent supportive housing program. There's 30 to 35 units, I can't remember. And it's scattered site, and we have a contract with our Turning Point partners to provide these wraparound services. That's called full service partnership, and that's a supportive housing model. Well, not everyone is qualified for the full service partnership level. And so we need to have a non-full service partnership level. But it all has to go around the housing first philosophy, which is to say, as an outreach worker, as someone with direct human service experience, I can't tell you the dream that I've always had is I have a back pocket with 5 keys in it that all unlock a door. And when I meet someone who's huddled up in the cold and I talk to them and I work with them for a couple days, I get to know them, I can hand them the key and say, you live here now, for now. It doesn't have to be forever, but you can get out of this situation right now. Here's your key. So that person might go into the house and punch a bunch of holes in the walls and break all the windows. We work with that. We start with the housing and we work from back to what you're talking about, where people are supported and people feel like they can handle a house and be a part of a house. But the cost of leaving some of these folks on the street is so much more. It's so much more. They did a study in LA. It's like $78,000 a year to have someone homeless on average, and these are the people who are like cycling in and out of jail, the ERs, all these places, emergency services. It's just this cycle. And then they go and they say, okay, they look at those people and they do a little study and they put some of them in houses, and there's problems, but that cost is so drastically reduced when they're providing the services in the houses, and the person's ability to find stability and to move up in that hope category and feeling a little bit more stable and secure and accepting of what needs to be done to get on into another stage of their life. The evidence is overwhelming. So we are going to start working on.
So this is where do we go from here?
Yeah. So we are going to start working with our Nevada County Housing Development Corporation partner, Jennifer Price, down in Placer, has recently taken it over, and we are going to lease up, master lease some units, and start working on a housing first model for some of those folks that I think we all know and see when we're driving to get our coffee in the morning. And you always wonder, that person, why aren't they in a home, and you might see some behaviors, you might smell something, but nonetheless, it's just the cost effectiveness of doing it this way, and the evidence that proves that people get better quicker and can move into those better stages of their life. It's overwhelming, and it's going to be a rough go. We're going to start it out, and we got to build the process out. But Bergen County, this is what they did. This is what Salt Lake City claims. I think it's a pretty far-stretched claim to say we solved homelessness. This is what we did. I think that, I think sometimes people ramp up their services and solve it for a minute, and then that dies down, and then the homelessness kind of continues in certain communities. So I think we have to be cognizant never to say we've solved something that's going to probably be a prescient social issue for a long time. But nonetheless, for some of the folks in our community who are really, really suffering, I think the housing first approach is going to get them off the street, and we're going to get them into services that are going to help them to find the next stage of their life. And I think it's the only way that we can really be moving forward. And I read the tea leaves, I read NOFA's, Notice of Fund Availabilities, from all the granting sources, and they're saying, how are you doing housing first? How are you coordinating services? What are you doing to get people a place that they can be during the day? So the plan that we put into place isn't a plan that I just came up with because I'm some person that knows these things or whatever. It is also based on the reality of where funding is headed and the requirements those funding sources have for you to get the funding. Yeah. So we're going to do it, and we're very blessed that we have a board of supervisors who has recognized this issue and has put money into it from our general fund for the first time to say, look, we're going to put some money into this, and we're going to give you a shot. When I first started, I was a program manager without a program and without any staff, and I'm slowly building out the program and leveraging as much staff that I can from the existing staff that we have, and there's a lot of great expertise. So I think we're poised to do something, and I invite everyone who wants to be a part of that to come to our Nevada County Continuum of Care meetings. They're the third Thursday of every month from 1:30 to 3:30 at the Rood Center in the Empire Room, 950 Maidu Avenue. So if you're interested in coming and learning about the plan, I say come, be a part of it. If you're, you're hearing something today that piques your interest and you want to know more, you can also check out the mynevadacounty.com. We have if you just search in the thing Better Together, we have a whole page now for the plan and for the group that's leading the charge. So you can kind of read the meeting minutes, see what the plan is, get some, there's an FAQ that you can, learn what is Housing First, what is FSP, what is HHSA, what is, all these acronyms. I mean, you have someone come to a meeting and they sit there and they listen to people throw acronyms around and they're exiting the door as fast as you can imagine. So hoping that we can use the site, direct people to the site to get people sort of tooled up to be like knowledgeable enough to sit through some of the sticky conversations we have and to come out feeling like, okay, I can plug in here, or I can plug in there. So that's a real big part of it.
Well, I can tell you this, just based on our time together, I'm more optimistic.
All right.
I really am.
All right.
And I think the county, by your skill sets, and frankly, I think by the DNA, I think Utah's looking down smiling, is been well served. And will continue to be well served by your efforts. And frankly, the county does, I believe, the board deserve a lot of credit for being this forward-looking and creating your position. So thank you for your time. Thank you for being here.
Thank you.
Thank you, folks, for watching. As I've said before, if you are interested, please click on the NCTV website. And if you want to donate, please feel free to do that. I believe these shows are showing at 7 p.m. on Mondays, so please tune in. Thank you for being with us.